Welcome to the Bright Eyes Podcast, advice for healthy vision for all ages. Your hosts are Dr. Bonilla-Warford and Dr. Beth Knighton, two optometrists who really see eye to eye. They can help you get perspective of the latest visual scientific evidence for improving your vision and helping you keep your eye on the ball. We have real facts and aqueous humor without making spectacles of ourselves. And don't worry, the jokes don't get any cornier than this, we promise.
From rainy Tampa Bay, it's the Bright Eyes Podcast. This is episode number 2. I'm Dr. Beth Knighton.
And I am Dr. Bonilla-Warford.
And today's episode is all about what is an optometrist.
That's right. But first, Beth, I need to acknowledge the elephant in the room. And that is, it really does not sound like we're recording this in a professional recording studio in New York with hundreds of thousands of dollars of equipment. Do you know where that is?
Because we're in our office.
We are in our office.
Recording this on the laptop.
That's true. We've got our Blue Yeti USB microphone and our laptop in the Blue exam room in Bright Eyes Family Vision Care. And it doesn't sound perfect, but it sounds okay. And hopefully over time, as we do more of these, we will make it sound a little bit better. I was too impatient to get started with the podcast, so Here we are. We're here.
So I get asked a lot about what the difference is between an optometrist and an ophthalmologist. And the main difference between the two is surgical treatment. So optometrists and ophthalmologists are trained in eye disease and how the eye works, but we take it from slightly different perspectives. So an optometrist will look more at the functional aspects of eyes and vision, how they work as a team, versus a ophthalmologist who will look at it from an eye disease standpoint, deciding if surgery or laser treatment or other options are needed. And so we both are critical to the eye care world. Without one or the other, it would really be difficult for our patients. And so the better that we can work as a team and be on board together for our patients, it provides better outcomes for everybody.
Yeah, I agree with that. I think that as a general rule, optometrists tend to think more about vision and vision development as people grow from being infants to toddlers to kids to teenagers to adults, how their vision changes and what their visual needs are. I think the ophthalmologists that I know, some of my friends who are ophthalmologists, they tend to think more about how the eyes grow and how the eyes age and what kind of diseases the eyeballs themselves can get. And that would include everything from cataracts and glaucoma and diseases related to diabetes and any of those things. And like Dr. Beth said, both are extremely important, but they do have slightly different perspectives.
The training for the two is similar but different in that optometrists and ophthalmologists go for their undergraduate degree, 4 years of that. Then optometrists go on to optometry school for 4 years. And of the optometrists who graduate, some of them choose to go on for residency for further training, like Dr. Nate and I did in pediatrics specifically. But there are lots of specialties that optometrists can go into. And ophthalmologists, when they leave undergraduate, go on to 4 years of medical school where they learn eyes and body, and then go on to do a 3 to 5 year residency in ophthalmology or their specialty, and potentially on to fellowship after that for further training. So that's the difference between an optometrist and an ophthalmologist, but then there's also an optician. And so, Nate, you want to tell us a little bit about that?
So before I went to optometry school, while my wife Christina was getting her master's at the University of Wisconsin in Madison, I was an optician. An optician is somebody who is specially trained in the fitting and fabrication and fixing and dispensing of glasses. And in some states, those are licensed. In Florida, you can get an optician license, but you don't have to have one. In some states, they're not licensed. So I had the experience of being an optician and working with glasses. And one of my favorite things about being an optician was repairing glasses when they appeared to be hopelessly damaged. Sometimes you have to be very creative to fix glasses so that people can use them until that they're able to purchase a new pair.
We've seen some come into the office that have been pretty mangled over the time.
It's true. So
what about orthoptist? Some people have heard of that. How does that fit in?
So an orthoptist is a form of vision therapist that works with ophthalmologists. I've known a few orthoptists. Unfortunately, they are kind of vanishing breed. They used to be much more common when ophthalmologists provided more visual training or vision therapy to help improve the functional vision of patients. They don't tend to do that as much, and so they don't have the orthoptists to help them develop those skills for patients. But they are very dedicated and knowledgeable people. They know a whole lot about the eyes and how they move and focus and coordinate vision. And then there's one more, and that is an ocularist. And an ocularist makes prosthetic eyes, or sometimes people call them a glass eye, even though they're not glass. But they are a fake eye if somebody either didn't develop an eye properly or they lost it due to trauma or some sort of injury. Ocularists, they are extremely talented artists that make a prosthetic that's comfortable for patients, and it's hand painted to match the other eye as closely as possible. I always think that that's fascinating work. There are some really great videos on some of these topics. There's a wonderful video that says it's all about I am a doctor of optometry, and we'll put that in the show notes. There's another video about what an optometrist is, and there's some ones about opticians and ocularists. So all of those.
Thank you all for listening. If you have any questions, comments, or suggestions, you can email us at office@brighteyestampa.com. Until next time, stay dry.
Brought to you by Bright Eyes Family Vision Care and Bright Eyes Kids. Find previous episodes, transcripts, credits, and more at brighteyestampa.com. Creative Commons Copyright Attribution Non-Commercial Use. Intro-outro music by Warford. The only purpose of this podcast is to educate and to inform. It is no substitute for personal care by a doctor. This podcast is provided on the understanding that it does not constitute medical advice or services. Please consult your physician for diagnosis and treatment.
No, I just thought you're
Gonna talk
an
more
optician. Like, you should talk about it.
Oh, that's true.
Like, yeah.